Hello, everyone. Happy first day of spring, and welcome to the fourth call in Lake Superior Quality Innovation Network's Introduction to Infection Prevention and Control series. Today we are covering transmission precautions in nursing homes, isolating the organism, not the resident. My name is Ann Haddad. I am taking over for Diane Dome today for the discussion of this topic. Okay. Today's objectives are listed on this slide. We will discuss how to recognize early indication of need for precautions and determine what, if any, resident restrictions are needed. I will also go over reevaluation and discontinuation of precautions and documenting precaution needs assessments. As a reminder, today is the fourth call in a series of open infection prevention learning calls. The next call will be April 3rd, covering common citations from surveys in our 3 states. This series is meant for the beginner infection preventionist or as a review for a more experienced IP. It is just a very high-level overview of basics. We will not get into the nitty-gritty today. These calls are not a substitute for specialized infection prevention training as required in the final rule. We don't currently have information on what will satisfy the requirement of specialized training, but we are awaiting directives related to Phase 3 implementation. Questions can be put into the chat box at any time during the call today, and we will open the phones at the end of the call for any questions. Today is an information-heavy presentation, so we may run out of time. But we will be compiling a complete list of questions and answers from the series after the final call, and that will be available on our website. However, if you would like an answer sooner and don't get a chance to ask your question today, Diane Dome has offered to respond to them personally, and her contact information is at the end of these slides. So without further ado, let's jump right into today's topic with the baseline of standard precautions. You may also have heard these called universal precautions. Standard precautions are based on the principle that any body fluid may contain a transmissible organism, so they are used every time with every resident. Along with hand hygiene, standard precautions help to prevent spread of infection and keep healthcare workers safe. So how do you know if standard precautions are not enough and you need to be using additional transmission-based precautions? There are a few resources that can help you with this decision. Increased precautions should be considered for any organism that is identified as multi-drug resistant. Your state or local division of public health will also have information and recommendations for you. The last resource listed on this slide from CDC, Appendix A, is a very helpful resource that should be available to your staff to consult. It covers abscesses to pneumonia to zoster, what kind of precautions should be implemented, and when they can be safely discontinued. So it's a really great idea to have this available for any questions that come up in your home. So then, what are transmission-based precautions or isolation precautions? These are used in addition to standard precautions to manage specific pathogens that may be highly transmissible or important to monitor. Transmission-based precautions, or TBP, are based on the mode of transmission of the organism, whether it is spread through contact, respiratory secretions, or in the air. This will also determine the type of personal protective equipment, or PPE, that should be used. We will review each type of precautions and the PPE indicated in the following slides. But first, we'll go over here a refresher on PPE. Donning or putting on PPE must be done in the correct order seen on this slide here. So always start with hand hygiene. Then first begin with the gown. Tie it securely so that it's not flapping in the breeze on your body. Next, use your mask, goggles, or face shield if indicated. That would be if there's a risk of splash or spray. And be sure to cover all mucous membranes, not just the eyes. These again need to be secured appropriately for whatever you're using. Gloves are last and should cover the wrist of your isolation gown. When it comes to doffing or taking off PPE, there is also a specific procedure to follow to reduce the risk of contamination from any organisms that may have ended up on your PPE. Gloves should be done very specifically to avoid touching the outside of the contaminated glove. So peel off the first glove, peeling away from your body and from wrist to fingertips, turning the glove inside out. Hold that glove you just removed in your other gloved hand, and with your ungloved hand, peel off the second by inserting your fingers inside the glove at the top of the wrist and sliding forward. Always dispose of gloves appropriately in the right receptacle, and again, always perform hand hygiene. In doffing the rest of your PPE, order is important to prevent contamination of your body and clothing. So start with gloves, carefully removing them using the method on the last slide to prevent contamination of your hands. For the gown, grab from the back of the neck and pull away from your body as you roll it up, avoiding touching any soiled areas. Goggles and face shield, if they were worn, you also grab from the rear. Do not touch soiled areas, and take off your mask from behind if worn. And as always, my favorite reminder, always end with hand hygiene. So you will not need to wear all of this PPE for every situation. So let's talk now about the specific transmission-based precautions. Contact precautions, or CP, as you'll see in the slides, are used for residents who are known or suspected to be infected with organisms transmitted by direct or indirect contact. Contact precautions generally mean gown and gloves, but may require a mask or face shield. In terms of the transmission, direct contact is person to person. Indirect contact is person to environment or equipment to the next person. The environment, which is a resident's room most of the time, as well as any equipment used, can become contaminated with that organism and can transmit the infection. Clinical assessment is needed to determine if secretions are contained and if the resident is cognitively able to follow directions. If a wound has uncontrollable drainage or the resident is incontinent, contact precautions should be used. A resident on contact precautions may be allowed to go to public areas as long as the site of infection can be covered and any secretions are completely contained. This depends on assessment of the resident's personal hygiene and behavior to determine the risk of transmission to other residents. If the resident is assessed to be able to safely leave the room, hand hygiene should be performed before their exit. I'm sure you're noticing already the common theme of assessment of the resident. Transmission-based precautions in nursing homes are a balance between restriction of the resident and prevention of transmission. If your assessment indicates that the resident should be under contact precautions, staff must wear single-use gown and gloves when in the room and remove it when exiting. Unless there is an emergency, no procedures or PPE should be in common areas. For any care that is required, the staff should assist the resident to return to their room and complete the care there before the resident can join back into common areas. Family and visitors are usually not required to wear PPE unless they are assisting with those patient cares. So APIC indicates that residents who are symptomatic with respiratory infections caused by multi-drug resistant organisms or active C. difficile diarrhea should not attend group dining or activities as long as symptoms persist. A resident that is colonized with C. difficile long-term, though, who may still be experiencing loose stools, but who is continent of stool and compliant with hand hygiene and staff instructions, could be reviewed for the possibility of attending activities. Again, this is a balance between restriction of the resident and prevention of the spread of illness. Documentation of your assessment of their continence and compliance is important. So again, contact precautions generally means gown and gloves. However, if splash or spray of fluids is a risk, all mucous membranes should be covered. Anytime you are using goggles, you should also use a fluid impervious mask or a face shield. So we'll move on now to the next type of transmission-based precautions, droplet precautions. Droplet precautions are for organisms that can be transmitted through the droplets generated from sneezes, coughs, or talking. These droplets can travel 3 to 6 feet or more. Some studies have even shown that large droplets can travel up to 10 feet. So this is why you put your surgical mask on prior to entering the room. So the types of conditions you'll see droplet precautions for are influenza, adenovirus, pneumonia, that kind of thing. In droplet precautions, spatial separation is important. The privacy curtain should be drawn between resident beds to catch those droplets, and then once the illness is resolved, the curtain should be changed. Droplet precautions at minimum require a surgical mask. Again, these masks are single use and should be secured behind your head. Always remove them when leaving the room and dispose of them. Do not hang the masks around your neck for use next time. Do not wear them into common areas. Airborne precautions are the final type of transmission-based precautions, and these are for organisms that can be transmitted suspended through the air. Healthcare personnel in these precautions must wear an N95 respirator for which they have been fit tested, not just a surgical mask. Or you can also wear a powered air purifying respirator. Airborne precautions also require what's called an airborne infection isolation room or a negative pressure room. These rooms have special ventilation that keeps the air flowing into the room and out of the common areas and contains the pathogen. Very few long-term care facilities have an AII or negative pressure room, and very few fit test their staff for N95 respirators. So if you are one of those facilities that just don't have those capabilities, a resident with an organism requiring airborne precautions should be transferred to a facility that is equipped with a negative pressure room. As soon as an infection requiring airborne precautions is suspected, contact and droplet precautions should be used as an interim safety measure. And then during the transfer to a facility that has a negative pressure room, the healthcare personnel should have their fit-tested N95 respirator, and the resident should wear a surgical mask. Transmission-based precautions are often combined if one of the categories does not cover every risk of transmission. So, for example, contact and droplet precautions may be used in conjunction for a GI illness, which would be contact precautions, and influenza, which would be droplet precautions. or for a resident with a draining wound requiring contact precautions and pneumonia requiring droplet precautions, these would be combined. It is important to review all of the resident's signs and symptoms to determine the type of precautions needed. All PPE is meant to be single-use disposable or laundered appropriately, and use disposables when possible. And for equipment, dedicate one piece of equipment or disinfect it between each and every use if the equipment is used on a resident in precautions. Some of you may have experience with transmission precautions in the hospital, which are handled differently than in long-term care. In long-term care, the balance between restricting the resident and preventing disease transmission is more important. The balance should be based on a documented individual risk assessment. So the documentation of the assessment of the resident and start and stop dates of precautions are often missed documentation steps. Surveyors will be reviewing a resident on transmission-based precautions, so this documentation of the assessment and the start and stop dates is important. When performing a resident risk assessment, keep in mind the 3 C's: contain, cognitive, and clean. Contain is, can secretions, drainage, and body fluids all be contained? Cognitive, can the resident understand and follow directions? And clean, how is the resident's personal hygiene? We have talked about the balance between restriction of the resident and preventing transmission of disease, and since this is their home, we want to limit restrictions whenever possible. Keep in mind when considering precautions and doing the assessments that there is a difference between colonization and infection. They are often confused, but colonization is the presence of an organism without signs or symptoms of infection. Colonization is usually not an indication for transmission-based precautions. So if your resident is not exhibiting any symptoms, be sure to complete a full assessment before placing them in precautions. However, please do be aware of your specific state requirements for concerning pathogens like CRE. These organisms are often subject to explicit containment requirements through your Division of Public Health. So we've discussed how to identify and begin precautions. What about ending them? Transmission-based precautions should be maintained as long as the resident has clinical signs and symptoms of infection. As soon as the symptoms have resolved and treatment is completed, the precautions can be discontinued. You want to return to normal for the resident as soon as it is safe to do so. The need for continuing precautions should be reviewed daily for your residents to help this return to normal along. Again, though, please be aware of state guidelines for specific and alarming pathogens like CRE. And finally, just some general tips for transmission-based precautions. If possible, do not have residents with different infections in the same room. If you are unable to move residents, separate them as much as possible with privacy curtains, distance, or other barriers. In all instances, staff should be reminded to change PPE between care of residents every time. Also, do not perform test of cure or clearance cultures when antibiotics are completed and symptoms are cleared. These tests can often identify colonization and keep the resident restricted for longer than necessary. Remember that the presence of an organism without clinical signs or symptoms of infection is usually not an indication for precautions. we go. To help with your survey when it comes to transmission-based precautions, review the critical element pathways on this slide here. This is what the surveyors follow when they review your residents on transmission-based precautions. They will look at appropriate PPE usage and confirm the least restrictive precautions possible for the circumstances. This is where all the documentation I've been mentioning throughout is especially important. Remember the importance of this in your survey. These next few slides all contain several resources where you can find extra information and guidance on this topic. So I will let you peruse those when you have the time. Come back in 2 weeks for our next call in this series, which will cover frequent citations in the survey process. You must register for this call, so please follow the link on this slide to do that in advance. And finally, in order to obtain a certificate of attendance of today's education for your records, please complete an evaluation of the call. The link can be found on this slide. Once it is completed, you will receive a link to print your certificate of attendance. And with that, we've got a few minutes for questions. Again, if I can't answer your questions here today, Diane Dome has offered to answer them personally to the asker, as well as add them to our Q&A. Her contact information is listed here. So, operator, will you please open the lines for questions?
And if you do have a question, press star then 1 on your touch-tone phone.
While we wait for people to get in the queue, I can go through a few questions that I've seen in the chat box. Let me see if I can find one. Oh boy. We have a question in chat from Brittany. It says, would you place a resident in isolation for droplet if they have respiratory symptoms but diagnostic testing hasn't resulted yet, such as a sputum culture for mycoplasma pneumonia or viral screening, etc.? That's a good question, Brittany. For most cases, if the infection is suspected, if there is if there are symptoms and the clinical signs line up with an infection, it is good to start the precautions even if the lab results aren't back, just to prevent any transmission. And then if the lab results come back negative, you can immediately clear those precautions.
And there are no questions on the phone.
Okay, thank you. There are a few more in chat. And just a reminder, we do have a couple minutes today for voice questions, or you can email them along to Diane. In chat, we do have some questions. It says, if a patient is asymptomatic but still on an antibiotic, can they come off of precautions? In this case, I think yes, if there are no signs or symptoms of infection, and the clinical assessment indicates that the resident's hygiene and cognitive ability is able to keep the other residents safe, then yes, precautions can be discontinued. There's a question from Teresa that says, we have a resident colonized with ESBL who is regularly straight-calfed. We have been doing contact precautions when performing this procedure due to the risk of splashing. Is this appropriate? Teresa, with an ESBL and a risk of splashing, yes, I think that is appropriate. Make sure that all mucous membranes are covered in order to not transmit that organism along to any of your residents or your healthcare workers. A question from Janelle says, what about residents who get shingles if your facility does not have N95 masks? Janelle, that's a great question to look into the CDC resource Appendix A, which is in the early chunks of these slides. Appendix A has a description of shingles, whether it's localized or disseminated, and which type of precautions they should be under. So if your resident has disseminated shingles, then they probably should be under airborne precautions. But I believe in Appendix A, if the shingles are more localized, the N95 masks aren't necessary. But please look in that appendix, and that's a great way to find the answer to your question. Sharon asked, if a resident has a diagnosis of C. diff and other chronic GI issues such as diverticulosis and IBS, what is the best method of deciding whether to discontinue precautions following antibiotic treatment? So Sharon, that's a great question that, again, is going to depend on resident assessment, whether they have the cognitive ability, whether their hygiene is able to keep other people safe, and whether their symptoms are able to be contained. So if this resident, as mentioned in the slides earlier, has loose stools but is able to contain them, generally if the assessment indicates that they can follow staff instructions and appropriate hand hygiene, then their precautions can be discontinued. Are there any other questions on the phone at this time?
None at this time.
Okay, thank you. We do just have a couple more minutes left in the webinar today, so I will cover a couple more of these questions in chat. There are a lot coming in. And again, Diane will be able to answer these if you need an urgent answer, or they will all be compiled and put into our Q&A document at the end of all of these calls. Sabrina submitted a question that says, we have a resident with a wound with MRSA. The wound is contained. We are just doing dressing changes with gown and gloves. There are no signs and symptoms, so can we remove precautions? Sabrina, if the wound is able to be contained, that is a good start. Standard precautions are always necessary, so gloves will always be required. But for MRSA, the added contact precautions are may be decided by your state or local public health. A great place to look for that also is in the CDC Appendix A document that is in these earlier resources. Amy asks if we have an example clinical assessment that our facility should use for appropriate isolation practices. And that Amy, is a great question. We don't have one that I'm aware of, but I will pass that along to Diane, and she will be able to either make one or find one, and I'm sure she'll be able to help you with that. If you want to reach out to her at the phone number or email listed on this slide, she will be able to help you with the appropriate clinical assessment. Diane entered a question that says, if a resident has completed an antibiotic for a UTI with MRSA and has no signs or symptoms of a UTI, then a follow-up urine culture is not necessary? And yes, Diane, that's correct. If the resident has cleared their treatment and no longer has signs and symptoms, then a culture for cure is not a necessary step. Tricia asked, do long-term care facilities really have airborne rooms to care for a shingles resident? Tricia, that is not common in long-term care facilities, although I'm sure some do have that. But for airborne precautions, most long-term care residents are transferred to hospitals or acute care for the time of their precautions until they're able to be discontinued. So we are coming up to time on our call today. So any questions that I didn't get a chance to answer will be compiled and into a document that will be put on our website after the end of these 6 calls. Or please do reach out to Diane at her email or phone number listed on this slide. I'll check once more. Are there any audio questions today?
And no audio questions at this time.
All right, thank you. Well, in that case, we will wrap up for today. Please complete the evaluation for today's call at the link found on this slide, and once completed, you'll be able to receive a certificate of attendance for your records. Our next call again is April 3rd, and please register in advance. We hope to see you there. Thanks, everyone. Have a great day.
Thank you, ladies and gentlemen. That concludes today's call. Thank you for participating, and you may now disconnect.